See, congenital childhood heart condition, we say it is like 1.7 per thousand live births generally. And sometimes in these particular incidence or prevalence will vary depending upon the population we are looking for. Like for example, in villages or remote areas, the actual incidence could be larger because they are not aware about the facts, and when the child becomes nutritionally not up to the mark, is not growing well, then they come to us for an evaluation, and then the defect at times gets detected. The atrial septal defect, apart from that, any other congenital heart defect is a very varied differences, because some defects cause or make babies turn blue. There are certain conditions in congenital heart which present with a heart failure at birth itself. There are many other congenital heart diseases where the great arteries also suffer. Those babies can come with shock, what we call it, that is hypotension or a very low BP, and the survival becomes very difficult. Certain heart conditions like hypoplastic heart syndrome, etc., are very having poor prognosis. To very advanced technology, sometimes they have this intrauterine procedures where which are of course under research, where they try to correct certain defects at the earlier antenatally itself. The red flags, I would always say, if the babies are not gaining weight in the first 6 months of life, when they should be getting like 30 grams a day. So example, after when you come for the 1.5 months vaccination, that time the babies should have at least 1 kg weight gain. If that is not happening and it is not persistent, if the baby you find is becoming tired, or baby is turning blue around the lips all the time, or when they turn blue when they cry, sometimes they turn pale when they cry. If these things are happening, they should be very much on alert. At times, babies also simply have hold breath for a long time, and that confuses the parents. In such kind of incidences are happening, they should take opinion with their pediatrician. And as I explained earlier also, if they have a suck rest suck cycle, or if they are having a lot of forehead sweating, then they should be getting it. If there are recurrent chest infections or pneumonias, or having breathing difficulty which is observable by the parents, they should look for a pediatrician's opinion. Medical option again depends upon the condition, because there are certain conditions we called as blue spells like cyanotic heart disease, and certain acyanotic. So if it is acyanotic, it still gives us time, and majorly the medical approach is to prevent any kind of heart failure, to augment the child's weight so that the surgery time the child is having optimum weight, so the surgery can be performed. Plus we also vaccinate the babies, because these babies are very much at risk to develop flu, to develop pneumonias and other kind of nutritional deficiencies. So this growth and development becomes very important for these children.
Follow us to stay updated on debates, discussions, facts and tips about health. Click on the subscribe button and the bell icon for latest updates.